Today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. I'd start by proposing a motion to adopt the minutes of the Audit Committee meeting held on February 5th, 2024. May I have a second?
Second.
I will poll each member for your vote. Dr. Pagan?
Yes.
Dr. Katz?
Yes.
Frida Wang?
Yes.
Motion's approved. Next on the agenda is a resolution for audit services. Mr. Guzman, please read the resolution into the record and proceed with the presentation.
Okay. Authorizing the New York City Health and Hospitals Corporation, the system, to execute an agreement with KPMG LLC for the provision of audit services on behalf of the system, including its subsidiaries, for an initial period beginning June 2024 through the end of the calendar year 2027 audit period, for an amount not to exceed $5,566,000 over the full term. The system will have the right to terminate the agreement without cause with 30 days notice.
Okay, if you'd like to proceed.
Sure. So a bit of background on the resolution. So our annual financial statements for the Health and Hospitals Corporation and its subsidiaries must be audited by an independent CPA firm as required by the PAAA, Public Authorities Accountability Act, and the New York City Health and Hospitals corporate bylaws. Federal and state agencies require audit certification of some of the course reports that are filed. Grant Thornton is the incumbent vendor. Their most recent contract expired in 2021 and had a contract value of $3,871,500. In 2021, an extension was signed and expires when all audits covering fiscal year end and calendar year end 2023 have been completed, which is on or around the issuance of the financial statements for one of our subsidiaries, calendar year 23, which covers March, April 2024. The extension contract value was $2,019,500. The entities that fall within scope of the audits are the New York City Health and Hospitals Corporation, Metro Plus, HHC Insurance, HHC ACO, NY Community IPA, Metro Plus 1X, which is, these two are actually new entities that are projected to come online. The audit services also cover tax return prep and state charities reporting for the Gotham Health FQHC. Next slide. So in terms of the RFP process, I'm going to turn it over to my Deputy Controller, James Linhart, who put the RFP together on the behalf of our division. Turn it over to him.
Thank you, David. Good afternoon, everyone. So the RFP criteria, I'm going to go over the minimum criteria that we established was that the audit firm needed to be on the New York City Comptroller's pre-qualified CPA listing, be registered within the state of New York to do business within the state, licensed and active in public accounting for at least 9 years, and of those 9 years, at least 5 of those years for successful experience auditing the revenues and expenditures and programs of state and local governments or health systems with revenues and expenditures of over $1 billion. And the auditor needed to have a MWBE status, a utilization plan, or a waiver request in order to participate in the RFP. The scoring, or the substantive criteria, was 40% based on experience, 20% on cost, 10% experienced in federal and New York State reimbursement methodologies, 10% experience with public bond offerings and related requirements of underwriters and attorneys, 10% of depth of tax issues, and of course 10% WMBE utilization. The evaluation committee was made up of 7 individuals. Their backgrounds are here. They were members of the financial audits, finance departments, and reimbursement teams, 1 member of the Law Office of Legal Affairs, 1 member of the internal audits team, and 2 individuals from officers from finance and other subsidiaries. Next slide. The overview of the procurement, which we started actually before November 14th of 23, but that was when we actually submitted the application to the CRC. On February 20th, the RFP was posted on the city record, and supply chain sent it out to 41 vendors. On February 26th, we held a pre-proposal conference. 8 vendors had participated in the pre-proposal conference. On March 13th, the proposals were due. We had received 6 proposals. The evaluation committee submitted their first set of scores on April 1st. It was deemed that a second scoring was needed, and in the second scoring selection, the evaluation committee selected KPMG LLC.
Cover this slide. So KPMG has done and continues to do some consulting and advisory work within our system. So there was some review of independence that's required since they were the top bidder. So in accordance with various professional auditing standards, including AICPA and GAO, KPMG must perform an analysis and determine that none of its advisory work would compromise its independence as our auditor. KPMG has completed an initial independence analysis at our request, which we have reviewed carefully and which determined that they do not have any advisory work with H&H that would impair KPMG's independence as our auditor. In addition, KPMG will complete a full independence and risk clearance process if they are approved for the audit to work. We will work closely with our counsel and KPMG to ensure that independence issues are fully analyzed and that appropriate safeguards, if any, are implemented before finalizing a contract with KPMG. Back over to my colleague.
So one of the, as we stated before, the MWBE goal-setting methodology for KPMG, they said that they will achieve a 25% goal setting, and they're using a vendor called Catabac, a CPA, or they're otherwise known as Team Avaloria. So they're, like I said, they're going to be using them for the audit. And the last slide, please.
Shall I read this, or do you have any questions so far?
Are there any questions?
So, last slide. Okay, authorizing the New York City Health and Hospitals Corporation, the system to execute an agreement with KPMG LLC for the provision of audit services on behalf of the system, including its subsidiaries for an initial period beginning June 2024 to the end of the calendar year 2027 audit period for an amount not to exceed $5,566,000 over the full term.
I had a couple of questions, if there are no questions. Grant Thornton's original contract before the extensions, was that for 4 years?
Yes, that was for 4 years.
And the second question is, we have a new accounting firm coming on. How do we see that affecting the lead-in time that's going to be required?
It's a good question. The good news is KPMG was actually our accounting firm before Grant Thornton, so they have a familiarity with our system. And there will be, you know, as with any transition, there will be some incremental effort pursuant to that transition where there's more of a discovery process that'll be necessitated. But because I think we're in a good position where we are thankfully presenting at this point to the audit committee, we don't see, you know, there'll be a big delay in terms of that transition process. It'll be a little, you know, this year will be atypical relative to prior years, obviously, since we've been with the same firm for 6 years. But a lot of that work, unfortunately, befalls, you know, our division, but we're ready to take it on and, you know, give whatever KPMG needs to facilitate transition. And I'm sure Grant Thornton would, you know, also work with KPMG in accordance with, you know, accounting standards and auditing standards to really facilitate that and, you know, have a professional type of transition.
Well, Grant Thornton isn't going away, so, right, they would, it's in their interest to be cooperative, right? Because just like KPMG had the contract before, they're going to want it in the future. I also think this one's interesting in that often we worry about changes in contractors, but in an audit setting, it seems like a positive thing. It seems like periodically you should change auditors, right? Because you'll learn new things, right, and
Fresh
it's,
perspective.
right, so that it doesn't mean even one is better or worse, but you tend to learn what you can learn, right? They've looked at your system for 6 years, be helpful to see what someone looks at your system now says, and maybe there'll be a day where you'll say, time
for
to
switch.
change again, right?
Absolutely.
So I would think that
Yeah.
the transition would be pretty smooth.
Yeah.
And one of the things I'd like to point out that the audit team that KPMG is proposing is familiar with us because they were part of our audit team back in 2017.
It predated Epic, so it'll be
Yeah,
interesting.
if you want to say that, yes.
Mhm.
So, and with the discovery stage, every auditor, every accounting firm usually always gives the courtesy of the new accounting firm the rights to open up the books and take a look and clip whatever you want to make copies of, and they would share their work papers with them. That's just normal practice. So
It's terrific.
we're just going to be a lot busier.
Yeah, because
That's all
your
that
audit
means.
delivery date does not change.
No, the audit delivery date is still October 18th, I think we have to deliver to Jackie over at the city. So, that's a date that's set in stone, and, we have to stick by it.
So does the contract actually start like June 1st or June 30th? I mean, can they get started before the end of the fiscal year?
I think we did time it to start
Well,
in June, right?
yeah, we're timing to start in June. We can't provide them any
Any
work
information.
papers or anything like that until the next round, because now we have to bring this to the board too. So that's according to what I'm hearing. So we have to, wait for that to happen.
If there are no other questions, this is an item for voting? Yes, okay. Then I'll take a motion for adoption of the resolution naming KPMG as our auditors for the next auditing period. Can I have a second?
Second.
I'll poll each member for his or her vote. Dr. Pagan?
Yes.
Dr. Katz?
Yes.
Frida Wong?
Yes.
Motion's adopted. Okay. Now we have a number of information items. We're going to start with our internal audits update. Joseph O'Keefe.
So we have another resolution.
Another resolution.
Oh. Okay, sorry. Got it. The next resolution for consideration is the appointment of the System Record Officer. Ms. Patsos, please read the resolution into the record and proceed with your presentation.
Thank you. This is a resolution approving the designation of Sophia Khalid, Executive Compliance and Privacy Officer, as the new New York City Health and Hospitals Corporation, the System Records Management Officer, the RMO, as that term is defined under New York State Education Department regulations found at 8 NYCRR Section 185.1A, to coordinate the development of and oversee the system's record management program in accordance with the requirements set forth under Article 57A of the New York State Arts and Cultural Affairs Law and the implementing regulations thereof. Sophia Khalid is to my left here. And pursuant to the Arts and Cultural Affairs Law, all local government public benefit corporations, which include the system, are required to designate a records management officer. And we currently have a vacancy in that position. And myself, a Chief Corporate Compliance Officer, has selected Sophia to serve as the system's RMO. Dr. Katz has concurred with my selection and joined in proposing Ms. Khalid to serve as the permanent RMO. She is currently as I said, the Executive Compliance and Privacy Officer, and she handles the matters related to Bellevue and Elmhurst and assists myself with various system-wide compliance matters and legal issues. She also handles matters related to HIPAA compliance and privacy, including participating in the annual risk assessments and reviewing and responding to potential compliance issues and complaints. She has been part of the Office of Corporate Compliance since April 2023, and prior to that, she was an Associate Compliance Officer from 2016 to 2021. In between, she served as Deputy Data Privacy Compliance Counsel at Bloomberg, where she served as a project manager for data protection impact assessments. She has a Juris Doctorate degree and is licensed to practice in the state of New York.
Excuse me.
She also, bless you, holds a certificate in healthcare compliance and received a healthcare compliance certificate from Seton Hall in June 2016. I believe she's well qualified to carry out the functions of the RMO as set forth in applicable law. And with the approval of the audit committee, I ask for the recommendation of the Systems Audit Committee of the Board of Directors to move the Board of Directors to appoint Sophia as the Systems RMO.
Okay,
Any questions?
okay, there being no questions, I'll accept the motion for adoption of the resolution. Second, oh, I don't have to take your vote individually. All in favor, please say yes.
Yes.
Any opposed? Congratulations. on
Thank
the
you so much. We
resolution.
appreciate your taking the role. Thank you.
Next on the agenda are a couple of internal presentations and informational items, starting with the internal audits update by Joseph O'Keefe.
The first three items we have are external audits that are being undertaken either by the state comptroller's office or the city comptroller office. The first one is audited Department of Corrections and efforts for mental health services. That audit's been going on for about a year now. It's been stuck in various legal issues over the last year, which they are now starting to make some headway and progress in the audit and get many of those audits straightened out. The second audit, which started back in December, is an audit of language services. They're looking over whether we have adequate supervision of language services that are provided at various facilities, interpretive services, etc. Like I said, that audit's been going on since December. I'm making some headway with that audit. Third audit is audit of behavioral health, the Be Heard program. That audit has also been going on for a little under a year at this point, which is the city comptroller's office. Does anybody have questions about the external audits? No.
Sorry, so two are from the city and one is the state, is that?
Yes, language access is the state, the other two are the city.
And the first one, is
Correctional
actually from January 2023.
That is the city comptroller's office, yes.
I wasn't sure if it was
The
20.
two mental health related ones are the city, the language access is the state.
Got it.
Okay,
The next is the items. We have 14 audits on the fiscal year 2024 audit plan. 6 of the audits complete, 6 are in progress, and 2 have not yet been started. Hopefully they will be started and completed by the end of the fiscal year.
You do still anticipate to do all of them?
Excuse me?
You do anticipate to do all 14 still?
They'll be started, whether they're completed by the end of the fiscal year.
Do we usually get a report on the audits?
Yes, you will be getting audits and reports under separate cover.
All right.
The last item is auxiliary audits. It's the audits that are being performed by the Bonadeo Group on our various auxiliaries. And as you can see, they're in various states of progress in completing these audits. The fiscal year 23 is the last year we currently pay for those audits, and this is the last year we will be paying for those audits. Now it's going to be the responsibility of the auxiliaries to have the audits done.
Can I ask, what's the legal relationship of the auxiliaries to us?
None.
none.
Really none. They're independent 501c3s.
Okay, and we've been paying for their audits because,
I think there is a long history to it that
It's just been a long history. They've been doing it, and it's one way of ensuring they actually get done.
yeah, they are fundraising
They are fundraising.
on our behalf, and I think at some point or another there was a decision made maybe a decade or more ago that was appropriate to ensure that we were
right,
getting what we
and now they're going to take on the responsibility themselves going forward.
Yes, which I think makes
I
more
think-
sense considering their legal
Right.
status.
I think both the legal and the policy issue of wanting to be clear that they're not us,
Right.
right? Because for other reasons, it sometimes gets a little dicey, right? Because they are independent 501c3s and occasionally they say things or do things that we might not be part of or agree with. And so we've been working to try to clarify that these are 501c3s and we are not in charge of them.
Right.
They are their own thing. And we've also been hoping in the process, some of them are terrific, raise a ton of money and do great things, and some of them are kind of dormant. And we were hoping that by making them do the work, maybe the ones that are dormant would either get involved or would cease to operate.
Right.
Because some of them, again, are amazing,
Right.
but some of them not.
In fact, we had a controller's audit on the auxiliaries.
Yes, there was a controller's audit of this, basically citing that we should have more control over the auxiliaries, but as Andy explained, we can't have, they are independent 501c3s.
Right. And so this suggests maybe a level of control that really shouldn't.
It really
that we don't
shouldn't
have.
exist,
Yeah.
yes.
Right.
Yeah, that makes sense. But I just wanted to, so in the revenues slide, in 2022, there are those negatives, or?
They are negatives for the year. Most of them are due to losses in investments,
Ah,
and it's negative for the year.
right.
There's 3, Bellevue Hospital,
Yep. Gouverneur and
Gouverneur, Bellevue,
Kohler.
all due to losses in investments.
I see. And discontinued means,
They are being dissolved.
yeah,
So 501c3, right. Okay, if there are no other questions, then we'll move on. I knew it. Catherine's came after on mine. No wonder. Okay.
Okay, can we move on to the next slide, please? So some of the activities of the Office of Corporate Compliance since the last meeting, as has been previously reported, we are doing the 2025 risk assessment, and we had OCC had met with internal audits and prepared the draft risk assessment, which we presented to the Enterprise Risk and Compliance Committee in February. At the meeting in April, it is going to approve the risk assessment, which actually is for compliance only, to be the basis of the FY 2025 corporate compliance work plan. We are also in the process, as I've previously reported, of the coal fire 2024 risk analysis as required by the HIPAA regulations. And the document collection, interviews, and site visits for the skilled nursing facilities and the acute care facilities have been completed. And the same for the diagnostic and treatment centers and the neighborhood health clinics has been started, and the interviews for those sites began in April, and the interviews began in April, the site visits will occur in May. We also have some updates on operating procedures. The Code of Ethics is a new operating procedure, OP 50-5, and what it has done is taken the previously existing Code of Ethics, which had applied to non-employees of the system because they were not, because they did not have to comply with the conflict of interest law of Chapter 68 of the New York City Charter. And so we wanted to align their requirements with the code, the conflict of interest law. So this new OP applies to both and incorporates the requirements of the conflict of interest law, but also sets forth similar requirements for non-employees and others that need to comply with similar requirements as the conflict of interest law. We will be sending out a system-wide alert that will alert everyone of the new OP and what the requirements are under it.
Can that be sent to the board also? Yes.
It's posted on it would be posted on the intranet if it isn't already. It should be, yes, it is on the intranet already. But we can send it out, certainly, yes. The other one that we have revised is a social media use OP. And this is to align with current social media outlets and our values and philosophies around the use of social media. And then there's an upcoming one is the procedure for identification of unidentified patients, which is an issue that has arisen in many facilities across the system. And we need to have a unified process for identification, with the process, the steps we would take to attempt to identify an unidentified individual who comes mostly into the emergency department. Any questions on those?
I just had a question on your compliance plan, the corporate compliance work plan. Does that come to the audit committee? Does it go to the board?
It comes to the audit committee in executive session, yes.
Okay,
And we'll be doing that in the July meeting.
okay. I can understand it would come in executive session.
Yeah.
Okay.
Any other questions?
Okay.
Maybe on to the next slide. As I've mentioned previously, we are developing in connection with the data and analytics team, a policy management tool. And that will allow us to automate our ease of drafting and revising all kinds of resource documents, including operating procedures, policies, guidance documents, tip sheets, anything of that nature that is considered a resource for workforce members. It will also automate the approval process for all of those types of documents and resources. The next step, what we have done is met with stakeholders to get their feedback on the tool and what their needs might be. And then we will meet with them individually to flesh out those needs. And in the meantime, EHS is putting into production and for development and for revising the operating procedures, which we hope to be rolled out in July. And we will upload all the existing operating procedures, and notifications will be sent out to the owners of those operating procedures that it's time for them to review and revise them through the tool. Any questions?
Maybe, Catherine, you can refresh our memories on the genesis.
Sure, this came out of actually a work plan item to update the operating procedure library, and then it kind of evolved into, well, let's get a system together that can, instead of just getting everybody to update their operating procedures, let's put in place a tool that will assist in that process and get all the operating procedures, some of which go back to
The
decades.
dinosaurs.
So this is a way to facilitate that process and make it easier for operating procedure owners to get them up to date and current.
Okay.
And also better for communication to
Yes.
all, to staff who are affected and.
Yes,
you know,
it will automate the distribution of the resource documents as well.
So can everybody access the library to look for operating procedures?
Even on the internet,
That would be
yeah.
much more functional.
It'll be searchable, there'll be keywords, tags.
And is there a policy for how often an OP needs to be updated?
That, it really depends on the individual operating procedure, but they should state in the operating procedure how frequently it needs to be updated.
Reviewed.
So we looked into the question of whether we needed an operating procedure for
For
our operating.
operating procedures?
Yeah.
Okay.
Okay, thank you.
We also conducted a workforce member compliance survey in December 2023. Unfortunately, the response rate was much lower than the previous year, but we are planning to coordinate this year's survey with Compliance Week so that compliance is on people's minds, and we'll get them to, we'll have our compliance officers encouraging people to take the survey. On a high level, there was an increase in respondents who knew how to contact the Office of Corporate Compliance or their compliance officers. Similar to last year, the supervisors and managers were the likely first point of contact for people who had a compliance issue. And which is fine as long as the supervisors and managers know to bring them to the Office of Corporate Compliance. Majority of them thought the training provided good guidance and they recalled key lessons from it. And more than half of them wanted to see more electronic communications from the OCC, which we will be doing as we roll out our communications plan in the coming months. The next few slides have some more detailed results. The next one is for each topic. We asked them to indicate whether they would bring those topics to the OCC. So it's basically yes, no for each of the topics. Fortunately, the majority of them were yes. And an average of 15% said they would bring them elsewhere.
Elsewhere, meaning like to their
It
manager?
was a yes or no. So it was
Oh.
yes, they would bring it, or no, they wouldn't bring it. So 15% said they would not bring it to the Office of Health Compliance, assuming they would bring it somewhere else. And the next, if they needed advice on a compliance or ethical issue, how likely would they bring it to any of these resources? And there was a scale of somewhat likely, very likely, somewhat likely, somewhat unlikely, and not likely. So consistent with last year, most of them were likely. And to bring it to their manager, supervisor, about 3/4 to the insider, 3/4 to their compliance and privacy officer, 3/4 to the Office of Corporate Compliance, 2/3 to a colleague, some would ask human resources, about half would go to legal affairs, and about a little over a third would go to Inspector General.
And a big chunk to Google.
To Google.
That was not a good score.
Yeah.
AI.
So we had a good response on the training question. They were very positively in terms of whether they remembered key lessons and applied them, and whether it was good guidance, and low scores on it doesn't apply and they didn't remember. So that was good. Any questions on the survey? Okay,
I
and
think it's a
then
good idea to do a lot of this during Compliance Week. You had a very lively Compliance
Yeah,
Week, so.
and this is one of the measures that we're using to try to evaluate the effectiveness of our compliance program, which we are required to do under the compliance regulations.
Okay.
The next slide is the compliance report metrics. This is the first quarter comparisons from 2022, 23, and 24. We did have an increase quite a bit in the first quarter of 24 in compliance cases. These are excluding privacy cases. And next slide is the report metrics for the for the privacy issues that come in, and we had significantly more compliance issues come in, or privacy issues come in this quarter compared to the first quarters in the previous years.
And what kind of cases is it that come in under the first compliance report metrics? The
For
60?
compliance issues, it's anything other than
Privacy,
privacy. So it could
so-
be misconduct, inappropriate behavior. It could be human resources issues. We get a lot of those. It could be issues regarding patient care, patient rights. It could be falsification of records. It could be, I think some of the other categories we have. Billing compliance, fraud-based abuse, yeah. So Sophia knows them better because she actually logs them into the system.
There wasn't one category that jumped out, right, in terms of a dramatic increase?
I think for compliance issues, we do get a lot of human resources and labor relations types of issues.
Okay.
Like, so-and-so is not compliant with the policy about no bullying.
Yeah,
They get a lot of, right, they use the word compliance to,
right.
so-and-so
HR.
is not complying with
Yeah,
kindness. So-and-so is not complying with
I see.
providing a respectful workplace.
I see.
Was just on the compliance one, the prior slide is the big drop in 2023 just that quarter dropped, or was the whole year a lot lower than?
I don't know, the whole year was not a lot lower because.
So it's just a timing.
Yeah,
Okay,
thank you.
all right. So we've concluded. Is there any,
Old business?
or?
New
I have some
business?
new business.
Yes. Oh, we have to recognize we have new business over here.
I have a question as to whether I
Yes.
can raise new business. No new.
Okay, hearing none, then I go adjourn the meeting.
This meeting is no longer being recorded.